evening, investors. Good evening, judges. Good evening, fellow housemates, and good evening, viewers. I'm Priscary, and my partner here is
Tyclev.
And together we are Team Hope. We can all testify to the fact that kidney health issues have become very rampant in the country. And due to how expensive the dialysis procedure is, a lot of people are not able to afford it. So we are here to pitch to you e-port dialysis, which literally targets expensive dialysis procedures, and it literally creates job opportunities for dialysis specialists, and it also helps in mobility services. So some of our features of our e-port dialysis is it's a pay half, pay other half later feature. It has an automatic appointment date. It's a specialist assignment. It features for medical and kidney health education, a Ghana card registration, a scanned help for diagnostic results, and a sole proprietorship.
Okay, thank you, Priscary. So, hitting on the features, but before I do, the issue of patients always having to move to a hospital in order to get treatment, it's bad, because what if there's a situation where a patient urgently needs attention and then they don't have money for transport, or their situation doesn't allow them to move to the hospital. Now, what ePort does is, one, when you register, of course, your first registration comes with a free treatment, a free treatment, which assigns you to a doctor and then a nurse. Now, the nurse is going to come to your house with a portable dialysis machine, treat you, of course, first treatment is free, and then go. Then after, you are going to subscribe. Now, the subscription is so cheap. It's just 50 cedis. Now, after you pay your subscription, it comes with a free health education, especially on kidney, how to treat kidney infections or how to manage them at an early stage. Now, ePort also opens a platform for doctors to register, which sorts the issue of employment, because there's a lot of doctors that maybe they are working for hospitals, all right, but then there's a layoff, or maybe some of them don't have a particular place they work. They keep moving from hospitals. So what ePort does is it gives them a chance to have a particular employment that is dealt around kidney issues. Now, ePort also gives automatic appointment dates, in a sense that sometimes patients can forget that today or tomorrow is their appointment date, and then they will stay home. Now, what ePort does is it prompts our team for them to come to your house and treat you without you reaching out to a nurse. Also, we have a feature that has a scan tab for diagnostic results. Maybe you went to a hospital and then after your lab results, a doctor isn't available, but you need another doctor to tell you what the result is. What you can do is take a picture of your result, put it on the ePort app, and then it will assign you a doctor to explain your lab results and what it carries. Now, our target market is centered around adults from 18 to 80 years and above. This app targets all classes, because even the rich sometimes cannot pay for dialysis, because dialysis comes with every 3 days, treatment in every 3 days. So what if you're not able to pay for 3 days straight? That is where our pay half and pay later comes in. Now, with our pay half and pay later, you start by paying 40%, then the rest of your payment is spread in 30% along the month. Now, our mode of operation, as I said earlier on, we have special assignments in every district. In every district, we assign 5 doctors per district, which will be attending to any patient that reaches out on the app. And then nurses will be assigned particularly to patients. Now, what happens is if you have been assigned a nurse to come to your house, you have a special feature on the app that allows you to request for the nurse to stay with you and take care of you till your case has been well treated. Now, our revenue strategy, we are going to be using our personal capital to fund our marketing strategy and then our startup cost. And then also, our subscriptions is going to cover up any extra cost that comes with maintenance, and then a server maintenance, and then some payments. Our selling price. Now, people may ask, how much is our app going for? We, ePort, want to be very affordable, be it to government or private hospitals. And then our selling price is going for just 10,000 Ghana cedis. Just 10,000. Now, our marketing costs. What ePorts will be doing is that we will be advertising through TV and radio broadcasting, PIS, which is public information systems, and social media ads. Now, our difference is that it will be a home service registration.